96% of women experience sore nipples in the first week of nursing, and most moms describe their pain as moderate to intense. And cracked nipples are prevalent in 32% of nursing moms in the first 30 days postpartum. These numbers might seem scary and put a new mom off from nursing. However, breastfeeding your baby gives them the greatest start possible for their immune system, plus a lot of other benefits. A mom's immunity is passed on to the baby through her breast milk. And what most moms may not know is that nursing is also the healthiest for new moms, both physically and emotionally. For the full lowdown, you can watch my video on the benefits of breastfeeding for baby and the benefits of breastfeeding for mom. Sore and sensitive nipples when you first start breastfeeding usually occur because your baby is not latching on properly. This means baby is not properly positioned or attached. One study shows approximately 72.3% are inappropriately positioned and thus poorly attached. If you do have nipple pain, you can watch my video on latching tips or speak to your midwife or breastfeeding specialist as soon as possible. Breastfeeding should not be painful. You can also use a nipple cream to help with the soreness and heal the cracks. Now, one big mistake that moms can make is using a nipple moisturizer that is made with water. Even though the product may claim to have soothing benefits, if the product has water in it, you'll experience the opposite effects because water-based products strip the skin and nipple of moisture, thereby dehydrating it even more. That can really hurt when you put on your cracked and inflamed nipples and make matters worse. Also, water-based topicals will always contain harmful chemicals that are not good for your baby. Products like Vaseline or lanolin that do not contain water are usually touted to help with dry or cracked nipples. Here's the issue with both of these. Lanolin is a wax secreted by the sebaceous glands of wool-bearing animals like sheep. Sheep breeds that are raised for their wool are the source of lanolin. Constant use of a lanolin-based product can result in the body becoming intolerant to it. This provokes an immune response resulting in contact dermatitis and allergic reactions. This is especially so for people who ironically use lanolin to treat skin conditions. Vaseline is 100% petroleum jelly. It forms a layer on the surface of the skin which slows the evaporation of water, thus moisturizing the skin. However, this layer blocks the pores and your skin's natural breathing process. And if you don't know, petrolatum is a cheap byproduct of oil refining. It's a gooey mixture derived from petrolatum, yes, gasoline, and is often contaminated with carcinogens. Now, that aside, what are the other possible causes for sore nipples? There's tongue tie, which happens in 23.2% cases. And that's when the strip of the tissue under the baby's tongue, attaching the tongue to the floor of the mouth, is shorter than normal. And this can prevent a baby from latching on properly. And then there's thrush. Thrush, or candida, is an infection that can occur when your nipples become cracked or damaged. Symptoms are usually severe pain in your nipples after breastfeeding. It's described as burning or shooting pain lasting up to an hour. Your doctor can prescribe treatment for you and your baby. Again, use a safe, water-free, chemical-free nipple butter with targeted probiotics. As I mentioned, safe, water-free products are made without harmful chemicals. And the ones I recommend are made from plant butters and oils and not petrolatum or sheep's wax. This way, you apply an all-natural, baby-safe product on your nipples. If you go for a nipple butter with the probiotic strain called Lactobacillus reuteri, this will aid in moisturizing or restoring your sore nipples after breastfeeding, and the probiotics are beneficial for your baby. And now, the top tips for soothing sore nipples. Some women find rubbing a bit of breast milk onto their nipples can be soothing. After each feed, let your nipples dry before getting dressed. Change your breast pads after every feed. Avoid using soap as this can dry out your skin. If possible, only wear cotton, not underwired bras. It's best to avoid using nipple shields and breast shells. These will not improve your baby's attachment to the breast. Try not to shorten feeds. Doing so will not ease the pain and may reduce your milk supply. And finally, as part of your daily self-care, and as I mentioned earlier, use a baby-safe, water-free, chemical-free nipple butter with the probiotic strain Lactobacillus reuteri to help keep your nipples moisturized and soft.